I'm Julie Breslin, Head of Programme for Drink Wise Age Well, and I'm going to tell you about how Drink Wise Age Well came about. Back in 2013, a fund called the We Think Good Health Fund was announced by the Big Lottery, and they were committing £25 million for 7 years across the UK to develop a number of different projects that looked at reducing alcohol harm in the over 50s. So AdAction had already been delivering a project called the Over 50s Alcohol Service in Drumchapel in Glasgow, and that service provided outreach support and peer support for people aged over 50. So we were already really committed to this issue, and we wanted to look at how we could work with some other partners across the UK to help reduce the harms for people aged over 50. So initially we approached some existing colleagues that we already knew, we'd come across working over the years. Addiction NI had already experience of running the Older Focus Service in Northern Ireland, and the Substance Misuse and Ageing Research Team in the University of Bedfordshire had already done some research with us. So we got together, talked about what we felt the programme would look like, and invited some other key partners to join us to basically bring a consortium of strategic partners together to make an application. So initially the partners were, what we needed was UK-wide coverage. We needed to have ageing expertise, we needed to have alcohol and substance misuse expertise, and we also needed to have a policy partner. So the group that came together, led by AdAction, included Royal Voluntary Service, Addiction NI, Drug and Alcohol Charity Wales, which is now developing a care in Wales, ILC UK, and the Substance Misuse and Ageing Research Team. So together we worked over a course of about a year to do a two-stage application to the Big Lottery Fund, and I think it was around kind of October 2014 we found out that we were successful. What we had looked at in terms of our model was using something called a community systems approach, which brings a programme into a community and looks at the whole population. So we work with people at every level. So there's a prevention element of the programme, which is about engaging anyone aged over 50 in the workplace or in the community to help raise awareness around their alcohol use and reduce stigma. We then looked at how we would help people working in communities and coming into contact with people aged over 50 to be better able to recognise and respond to the needs of older drinkers. So we created the training and work stream development part of the programme. And then we looked at resilience, which is about increasing people's capacity to cope in communities, particularly when they were going through life transitions such as retirement or bereavement. And that would be about increasing people's social cohesion and community participation. And finally, we knew that the over 50s population could often be very, very hidden. There's a lot of shame and stigma around alcohol use, and also people at that stage in their life, if they've been drinking for a long time, will have very, very complex needs. So we created the direct engagement and support work stream, which provides an outreach, primarily home visit model to people to help them reduce the harm caused by their alcohol use. And within this work stream, we also looked at supporting family members as well. So this model, as I said, based on this community systems approach, is about engaging people in the community at every stage of their risk to alcohol use. We looked at going into populations that were of about 500,000 population size, and we wanted to select a difference between rural and urban kind of centres across the UK. So we selected Glasgow for Scotland, Devon and Sheffield in England, Cumtaff in Wales, and the Western Trust Health area in Northern Ireland. And each of these areas have also got a control area because there's a full evaluation model involved with the programme. Really, the essence to me around Drink Wise Age Well and what makes it really important is the co-production element, and it's making sure that the people that we support every day don't become passive recipients of our help, they become active participants. And I think going into year 4 of the programme, we see that hugely. We see that hugely with the volunteer involvement. We see it with people becoming map facilitators, peer educators, and really what's important to me when I go out to visit any of the services is that you walk in the door and you don't know who's staff, you don't know who's a volunteers. There's a real collective ownership of the programme. So we're now in year 4. This is really an important stage about how do we take the real learning from the programme and make sure that we can create a model of sustainability and hopefully see the Drink Wise Age Well model and the learning from it being used across the UK. It's something I'm really, really proud to be involved with. Probably the highlight for me was the staff conference in Bristol in November, where we brought everybody together and were able to really present and demonstrate the amazing work that all our teams have done out in the areas. So as I said, very proud to be part of it.